On Saturday, June 27, 2026, journalist Katie Couric was in Aspen, Colorado for a speaking engagement at the Aspen Ideas Festival. Shortly after arriving, she began experiencing a profound sense of disorientation. When doctors began to examine her, she found she couldn't recall the correct month or even the current year. She told the medical staff it was 2024 and that Joe Biden was still the president. At the hospital, she entered a loop repeating the same questions. Every time a new nurse walked into the room, Couric introduced herself as if the encounter were happening for the very first time. For her family, seeing her short-term memory reset every few minutes was terrifying. The sudden onset of these symptoms looked and functioned exactly like an active, life-threatening stroke. It's important to note that our analysis is based on publicly available reports from this incident. We are not Katie Couric's physicians, and this information is for educational purposes only. At the hospital, Couric was immediately prepped for an MRI scan. Doctors needed to see if a blood clot or a bleed was currently damaging her brain tissue. The results were unexpected. The MRI scans were clear, showing no signs of an active stroke or structural damage. The data on the screen didn't match the patient in the room. If her brain wasn't bleeding or clotting, what physical mechanism could cause hours of her life to simply vanish? Doctors eventually identified the cause, a rare temporary anomaly called Transient Global Amnesia, or TGA. To understand TGA, you must look at the hippocampus. This small structure deep in the brain acts as the command center for processing new information. During a TGA event, a temporary disruption in blood flow to this area causes the region to essentially go offline. This explains why she knew who she was, but couldn't remember what year it was. Her long-term storage was intact, but her brain's ability to record new data had broken. It's often described as a temporary power outage that suddenly disables the brain's internal save button without any warning. These glitches follow physical shock, intense emotional stress, or extreme exertion. Research even suggests they are more common in high-altitude environments, like the mountains of Colorado. Fortunately, the episode is self-limiting. The brain typically reboots and recovers its memory function within 24 hours. While it leaves a permanent black hole in the memory for the duration of the event, TGA is a benign condition. It doesn't increase the risk of a future stroke or the development of dementia. While Couric's specific diagnosis was harmless, it serves as a stark reminder of how fragile our cognitive health is and how it depends on stable, healthy blood flow. Your vascular system is a single plumbing network. Arterial health protecting your heart also sustains your brain. Keep these pipes clear by managing specific numbers. Maintain LDL cholesterol below 100, ideally under 70. Keep blood pressure below 130, ideally under 120, to reduce strain. While managing these metrics won't necessarily prevent a rare event like TGA, they are your primary line of defense against permanent threats like heart disease and vascular dementia. For more deep dives into the science behind medical headlines, this is Elton's Health Hacks. Follow us on your favorite streaming platforms. However, there is one absolute rule you must follow if you witness a sudden neurological change. If you experience sudden memory loss, sudden slurred speech, weakness on one side, or facial drooping, do not wait to see if it's just a glitch. Do not drive yourself. Do not go to urgent care. You must call 911 immediately. Katie Couric was lucky her symptoms were temporary. Always treat these signs as a worst-case scenario. When it comes to the brain, time is everything.